Hello, everyone, and welcome to another informative episode of the Florida Business Forum podcast. Let's open the Florida Business Forum floodgates and let the information begin to flow. Here's your Florida Business Forum information guru and anchorman, Sam Yates. Hello, everyone. The information floodgates are indeed open, and we have lots of information to share with you today. The number one business forum podcast in Florida, and I'm going to start by giving you a little background information. I'm Sam Yates, your host for the Florida Business Forum podcast, owner of Yates & Associates Public Relations and Marketing. I'm active in a number of healthcare coalitions throughout the state, a consultant to the urgent care industry, and well connected to the state's regional area aging councils, all 11 of them. So I do that as a little bit of a background so that I can introduce my guest today, and quite well spoken in some of the medical fields. But, I am not the expert, but I do have the expert with me today. I have the Chief Medical Officer, Vice President for Martin Hospitals, Dr. Rishi Singh, is here with us, and it's my honor and my pleasure, Dr. Singh, to welcome you to the program today.
Thank you, Sam. Thanks for having me on the Florida Business Forum.
I think it's really critical that right now we get information to the public about what's happening with Martin Hospitals, but I always love starting with my guest to tell a little bit about yourself.
Yeah, I'd love to. So I am an ophthalmologist by training. I've been with the Cleveland Clinic for 18 years. I was up in Ohio for many years, and I got a call to come down and to help with our Florida operations and what we're doing in this area. I didn't know much about Stewart, didn't know much about Martin County. I've been thankful to be here. I've landed in probably the nicest part of all of Florida, I believe, and certainly the nicest community and the people in this area that I've been able to meet.
Now, you mentioned the ophthalmologist. You're also a professor of ophthalmology, and I really zeroed in when I was doing a little background information about you that the reason you got into that particular profession is because of the long-term relationships that you have with patients. And I thought that said a lot about you. And it really, brings to the forefront that you're a people person, most of all.
I think that as doctors, we all want to care for people in various ways. Some want to do surgery on them, some want to take care of them in the medical sense. But some of the most rewarding benefits is to see the evolution of a patient over time. And ophthalmology is one of those areas where you have the longest lasting relationships of probably all of medicine. And in fact, you can improve their welfare, which is really impactful. To restore sight or to improve sight can be life-changing for people. And it's really been my call to arms for many years, and I've been very proud to be an ophthalmologist.
One of the things that impresses me with Martin Memorial, Martin Hospital Systems, it's a hard habit to break when you say Martin Memorial, but with Cleveland Clinic, executives are practicing physicians. You're still a practicing physician.
I am. So Cleveland Clinic historically has had physician leaders, and it's a physician-led organization. And I always say this in the nicest way: we probably make bad business decisions for the good of patients, because we're not the bean counters, we're not the people that are necessarily running a master's in business program before we get to this spot. But the reality is that healthcare has become a business. It's a business we have to focus on from a profit and loss margin statement. But at the same token, we are a nonprofit organization. That's very different, Sam, overall, than some of the other hospitals in the area. We really focus on providing high quality care to our community, which is a very, very different focus than an HCA or tenant facility. Those hospitals are great, but they really focus on specific service areas. And that's a very, very different mission from us in caring for our community through our hospital system.
And I'm glad you said that, because many times we hear about those specific care areas, and I think perhaps the general public does not realize what those general specific care areas really are profit centers.
Yeah. Yeah, and I think that, again, with our areas that we talk about, when you look at the gamut of healthcare, from maternal fetal medicine, the mothers who are laboring in our facilities, just here at North Hospital, for example, Many of these hospital systems that you talk about, HCA, Tenet, they would never entertain a program that would take care of these people because they would say, well, their margins aren't very good, and I have to be in a high volume business in order for me to do that sort of thing. Whereas we know it's a vital part of our community. We're the only place to birth right now in Martin County.
Yep.
If tomorrow our hospital, which has faced, upheaval of our finances and certainly an uphill battle in regards to our cost of care, it decided that this was not possible, this would hurt our community. We have made strong commitments to continue this despite that efforts, and we balance that with the other things that are profitable in our hospital that do bring in dollars to the hospital. Again, at the end of the day, it's to balance our books to make sure we are a nonprofit organization. Whatever profit is made there, we put that back into the organization, reinvest in the community. And I will say this much, that one of the misnomers is that Cleveland Clinic is a large enterprise-wide organization, which it is. But any money that is created and generated here is going to support our local Florida market. Any philanthropy we generate here goes to support local Florida markets. It doesn't go beyond even Martin County. And I think people don't necessarily understand that from the standpoint of how we operate as a system and how we're doing it here and locally.
I think that's an important thing because a lot of people, and myself included, my son was born at Martin Memorial, and I just referenced it a few moments ago as Martin Memorial. That was quite a transition from Martin to Cleveland. Walk us through that. And for our audience, I have to say, in all honesty, Dr. Singh and I met a few weeks ago face to face in preparation for this and other things that are going on. And I was very surprised at how frank and honest you were about the finances. But walk us through that transition with Martin.
Yeah, so the Martin Hospital system came to us about 6, 7 years ago and said we really want to grow ourselves from a community-based hospital into a tertiary care organization. Martin Memorial System has been around since 1930. Cleveland Clinic's been around since 1920. Both historical improvements and accomplishments over those time periods. And Martin Memorial System had done a great job of being a good community hospital, one that you gave birth in, and one that you potentially had some minor issues taken care of, and your last rites, done in this facility. But the in-between care, the cancer care, the heart care, the care for orthopedic issues wasn't really being performed very much at all in the past couple of years, and certainly was being let go of, I think, a lot. There was a lot of inability to get those specialists here to be recruited here to work for this hospital because of its name and its stature. And again, it had a great name as a community-based hospital, but it didn't have a national ranking and all those sort of things that go along with it. The Cleveland Clinic was asked to come in and to take over this hospital system. And by that, we didn't pay a dollar for the hospital, actually. We actually took it over and said, we will now go back and reinvest into the community. We'll provide community-based benefit. We'll provide new services. We'll provide more doctors. We'll provide more building. And we'll do all that on our dime to help the community and to grow the community standards. And it's now been 5 years in the making of this agreement that we've just have celebrated the 50th-year anniversary of it. And I can tell you, there have been a huge number of improvements since that 5 years have undergone. And I'm happy to give you just a microcosm of them. But
Sure.
we've doubled the number of doctors. We've tripled the number of advanced practice providers. We've expanded care in 13 specialties since being here and increased the number of care areas we can provide. We've increased our physical plant spaces in various areas in our ambulatory centers, outpatient centers, those facilities. We've actually increased the number of births that we do. We are now the largest place to birth, both in the Treasure Coast, between Indian River, between Martin Hospital and North Hospital, and our Tradition campus, which we birth at as well. And we've continued to contribute dollar for dollar to the community. We've almost contributed almost $350 million to both directed care, philanthropic benefit, and other areas here to the community. We keep doing that each and every year. We keep investing. I just got the budget for next year. No surprise, we're reinvesting even further into our systems here. And we are challenged by a lot of things that hospitals are challenged by. Influx of patients, the seasonal nature. You can imagine if we were in a business where every day the same 100 people showed up, it'd be fine, we could manage. But some months it's 300 and some months it's 50 people because of the seasonal nature of what we see in the market sometimes. The cost of care has risen, as you can imagine. Inflation costs. I think, Sam, you and I go to the gas pump or we go to the grocery store and things cost a little more these days than they ever have before in the past couple of years. And we're seeing an economic shift in regards to that. And so we've had to really adapt to that environment in this market very well. And it's been a slow struggle, but we've been able to do it. And I've been very proud of our teams for being able to do so.
Over the course of 5 years of making this happen and bringing it to where it has gone through a lot of trials and tribulations, and today, you're looking ahead to what's happening in the budget and everything. It doesn't always go smoothly, though, and I think we would not be hitting the mark if we didn't touch on some of those areas that we both hear, and I know you hear because
Yeah.
you've let me know, and our community knows about some of the problems. One is communication, and
Yeah.
anytime I talk to somebody and deliberately ask them, "What's your biggest concern, complaint, gripe with the hospital?" And it's the telephone system. Tell us about that.
No, it's an antiquated system. It really honestly is a system that is inefficient, and I have to be honest with you, has been our biggest Achilles heel, and we are improving that drastically. We rerouted all the phones to the actual specific offices in which those patients are being seen now. But it was very difficult to do so, Sam. We had on a typical Monday, we get 13,000 phone calls that come into our center on a Monday morning. And that's very, very difficult to manage, as you can imagine, that number of phone calls. The sheer volume alone speaks to the fact that the community, um, and we've looked at this, by the way, in a marketing kind of survey. We can be of different demographics, and sometimes different demographics use different communication styles. Some use email, some use chat, some use our portal, some use our phone system, and phones appear to be important to still have here. And I think that that's something we're improving on as we do continuously in the process by embedding technology to call you back when it's time for your time in line, which is coming soon. All these sort of activities that I think are very beneficial. But I think that's been the other one that's sort of what I call the front pipe. The back pipe has been the number of physicians, doctors, advanced practice providers, because this has been a market in which Florida is a very competitive market, and to be able to recruit doctors takes time. We can't just flip a switch one day and say, hey, we have enough people. It does take weeks, months, even years to recruit the number of people we have. And I think that the people feel the tooth aspects, I would say to you, are our phone system, which again is a work in progress, and the back area, which is the number of providers we have. We're just increasing it rapidly over time. And just to give you a sense of that, we've doubled, the number of doctors I told you before, but we've actually improved and gotten services here that were just never even here. Cancer care, for example, is now embedded in our hospital with 6 doctors attached to it. That's a huge undertaking for any organization, and certainly ours, but we were able to do it.
Along that same line, as we're talking about physicians, you have increased staff, but community-wide, there seems to be a perception that you're losing doctors. What do you say when someone doesn't listen to what you're saying?
Well, I think again, in every situation, there's bad attrition and there's good attrition. There are people that we came here and we literally said, we're just the Cleveland Clinic, and they said, I'm out. And I don't really understand it, but there are people that just don't want to be under organized medical care. They want to be in their own practices, and I don't blame them. They want to be in their own businesses, and that's perfectly fine for them to do that sort of thing. I would say there've been some one or two or three sort of regrettable departures for us as an organization. But it's never been that we've actually exited anyone, just to be clear. So these people have left. Any individual has the free will to leave on their own volition. And it's not because we haven't taken care of them or we haven't done anything else. It's really a lot of times voluntary in nature. I can count on one hand how many times we've had to eliminate a physician here for bad practice or behavior because we actually have good doctors here for the most part. But there are those individuals who are just the squeaky wheels, unfortunately, and they think that we're pulling the wool over their eyes or something else. I can tell you, I live and breathe my organization every day. I wake up every morning knowing that today is going to be a better day than yesterday. And I have to be honest with you, I wouldn't be down here, moved away from my family and moving them down to Florida if I didn't believe in what we're doing here. We are making a difference in this community. And it does take a journey. I think that the journey is something that people are a little bit impatient by, and I understand why. Healthcare is very scary. Just imagine today if you have a medical problem, having to wait because there's not enough doctors and nurses and so on and so forth. Thankfully, we've been able to hire a significant number of nurses and hire a significant number of doctors, so I wouldn't feel that way anymore. But back about 2 years ago, when we had a significant labor flux in the organization, yeah, there were some really tough times. And so doctors got very frustrated, and some nurses got very frustrated with how many people we actually had. And that again was because it was COVID. Traveling nursing made a ton of money, and rightly so. I think nurses were underpaid for many years, and so they decided to go on the free market and get travel all over the country and get huge paychecks for what they were doing. And kudos to them to do it. But now we're back to a simpler time, a different time, a time post-COVID where we feel like we have a great team of doctors, nurses who are working together. And I'm tickled pink to see what happens the next year or two with regards to what we can achieve with this team that's now in place.
And I think from a layman's perspective, sometimes our community doesn't quite understand, nor really, in some cases, they don't want to know the intricacies or even the nuances of the healthcare system. I can say in one particular case, and obviously I won't say by name, but there was a physician that I know about that left that could have been a liability. So for those that are thinking out loud, where we have a loss, well, sometimes, as you said, it's for the better.
Yeah.
But those that's business as well. When you're talking about influx of people into the area.
And I'll say this much, Sam, we are a quality driven organization. We pride ourselves on outcomes. We meet every day at 9:30 in the morning in a huddle group. And what we're doing in that huddle group across the entire Florida region, by the way, is discussing our patient outcomes, our patient experience, if there's been any deficits in care that have occurred, any errors in medical care that have occurred, and we elevate them to the highest levels of the organization. In fact, every day at 11 o'clock in Ohio, Dr. Mahalovic, who's the head of the organization, listens to the report out of each of our hospital systems to understand what is happening each place. We are focused on quality, patient experience, and outcomes. And that is a very different mission than a volume-based driven mission that might be at another facility. And I know that, our reputation has been tarnished for a lot of different reasons. Also, I believe that we have not been proactive about talking about what great things we have done to this community. This hospital probably would have gone under if it wasn't for the Cleveland Clinic supporting it through the last 2 years because of the amount of money that was required to keep the hospital on life support when there was no nursing here. We brought in traveling nurses to a significant degree. And the first year I was here, we actually lost almost $70 million to our bottom line. And it was because of the Cleveland Clinic that we were able to make up that deficit. And this year we're losing far less money than we did last year, which is a great thing. We're in the right direction, but we're still losing money. However, the Cleveland Clinic has a very strong balance sheet and is able to support us through this tough time. And they believe, as well as I think our community believes, that we can do a great job improving the care that we can provide those individuals who live in Martin and St. Lucie counties.
After our first meeting, I took the opportunity to do a social media post on one of the neighborhood social platforms, and some of the comments were very negative. And in the first 48 hours, more than 7,000 comments, people views. But I want you to know that the majority of those comments and posts were positive. So, as easy as it is sometimes to get wrapped up on the negatives of everything, I think it's important for you also to know that there's a large segment of the community that is not complaining, but that is
Yeah.
supportive. of the
So,
hospitals.
and Sam, I can tell you, for first of all, I think good news sells better than bad news 6 days to Sunday. So, the second thing is we take every patient complaint very seriously. There's an ombudsman who takes in every complaint. I get copied on all those complaints. We actually investigate each one of them. We have a response time of 7 days to respond to every patient who has a complaint about us as an organization. And we take pride in responding to them because we want to make sure we investigate each one, look at its source, see if there's common themes. If there's a common theme of some individual or some area or some area focus unit, we can certainly address that for the patient and do that. So we take these. I think the bottom line is good or even not so good. We like to hear about those things, and I urge anyone who's listening to this to keep asking us and giving us feedback on what we're doing. I don't mind feedback. I think it's a very good guidance point, host. But the interesting thing to me, Sam, to be quite honest with you, is the number of solutions that people come up with are great, and I'm happy to have solutions. But when you see things that are published in papers that are just totally false about us, it really saddens, I think, the organization ultimately. There was a post this last 2 weeks ago in TCP Palm about somebody suggesting that quantum computing could solve the problems at Martin Health. I have to say that is the most off base discussion anyone could have about this. Forgive me for saying so, but the reality is that it is a strictly a basis of personnel, people, and process. It's really people, process, and the technology that needs to supercharge our ability to take care of people. And the technology is not quantum computing, which only exists at one place in the entire United States, which is in Cleveland, Ohio, actually. But it's actually the fact that we implement good processes to improve this. And when you're hiring individuals, as you know, Sam, and if you've run businesses like we have, when you hire people day one, they don't start to perform at the 90th percentile. They start to slowly ramp over time. And what we're seeing right now is those people that get into our services from a patient perspective love the services we can offer. Those patients that can't get in are unfortunately are still troubled by it. And we're going to make more space for them. We're going to get them in. We just need more time to do so, and we're working toward that.
I saw that same post, and it was a head scratcher. I was like, what in the
Yeah.
it's like people tout AI has a place in the medical field, but
Yeah.
90% of the time, I think what people are referring to is artificial ignorance instead of intelligence. But that one was one of them.
And we are using, for example, artificial intelligence to help us better staff our hospital, to better determine where there's variances in call volume so that we can get our calls answered at a certain time of the day. We're using artificial intelligence to answer people's messages. Chat GPT is coming to us to answer people's messages in our system as well. So there is value to it. It's just when you talk about these articles that get published in major publications, by the way, and I've reached out to TCP Palm and I've been surprised that they don't even proofread this stuff anymore because it just seems like they're just fishing for anything to put into their journal. Because clearly they could have come to us and talked to us about it and learned about what quantum computing offers, which is fantastical, but has very, very little relevance to what needs to happen in our communities and to take care of patients ultimately.
To be real honest, the demise of local news at all levels is one of the reasons that I'm doing this Florida Business Forum and other podcasts because it's going away. Unfortunately, it for different reasons, but that's a good point.
Well,
Definitely.
and I applaud your ability to do this and blog posting and things like that that gets out. And I do it myself, by the way, and the friends and neighbors of Martin of this area. I do them on Nextdoor. I do them on all these different media social channels. We have a big following, even on TikTok for that matter, of what we're doing in the hospital, just to get out the word of what we're providing the community.
It's another tool. Let's touch on some of the positives.
Yeah.
We've gone down the negative route and how you're addressing it, but I'll mention what I know and let you fill in the blank. Cancer treatment trials.
Yeah. We were the first to offer them in Martin County here at our Weissman Cancer Center, and that was a first for the entire county. If you're a patient with cancer care or cancer diagnosis and you need to have care, sometimes there's not always a treatment for you. you're hoping for a clinical trial that you can get involved with that could potentially change your life. We had a total of 10 trials added to the existing number of trials that we had last year. And I'm actually doing one of them myself and helping that out as well.
That is awesome. One that I'm familiar with through the various healthcare councils is something that started, I believe, at John Hopkins, and that's the hospital at home. You're involved in that now.
We are. Yes, this is another great opportunity to transform healthcare in our community. We released this recently in St. Lucie County at Tradition Hospital. It's taken up huge uptake as far as delivering hospital level care in the comfort of your home with our paramedic teams visiting you 3 to 4 times a day, a nurse on call with a monitor system. You don't even have to have an internet connection. It's all driven by cell service. And so we can do it even in your own home with you. And this has been a huge benefit to our patients and our community. It's avoided days within the hospital, the brick and mortar structure, and it's delivered high level, high quality care that is high patient experience regarded. So we are the fastest growing hospital care home program, and it is coming to Martin North and South Hospital actually in February of this year.
Something to look forward to there. It's the advances of how people are cared for. It just fascinates me. It really is. It's amazing. As you continue to improve overall, one thing that comes up is the hospital grading system. I'm
Yeah.
not quite sure that I agree with how those grades are made. Touch base on that.
Yeah, so everyone, and even including you, can have a ranker and rater, and every one of their methodologies are different. And so sometimes the methodology changes and you perform really well, and sometimes it does not perform as well as we want it to. There's Press Ganey, there's Healthy Grades, there is Leapfrog, there's a lot of these. And unfortunately, the Leapfrog score that we got this year was not optimal, but reflects data from almost 2 years ago. What Leapfrog does, it looks at data not from just this 6 months ago or even 3 months ago. It looks at some data in arrears for almost 2 years ago. And I remember, Sam, when I talked to you about this and what we were doing 2 years ago, it was a very bleak time in the Martin Health system. We had lost a lot of nurses. We have a total component of around 1,300 nurses. We were down to 850 or so nurses by that point in time. Just imagine that for a moment. 1/3 of our population nurses decided to travel at that point in time or stop working because of COVID being so detrimental and concerning to them, which I understand. And so this was where this grading system came in about. Now, if you look at the other grading systems, for example, like Healthy Grades, we achieved 5-star status, which is the highest status you can achieve in 9 specialties: cardiothoracic care, cancer care, lung care, orthopedic care, maternal fetal medicine. All these areas we were able to achieve a 5-star status, which is the highest you can achieve and meets national ranking in those areas. So just for comparator, I think again that while these rankers and raters are important to some, they're not the be all end all. And certainly if they don't use data from very really relevant time frames, it becomes irrelevant to what we're talking about today.
I have found that complainers look for the worst things that they can use to support their complaints. So,
Yeah.
it's really why our rear view mirrors are smaller.
Yeah.
So kudos for making things move forward.
Yeah.
Another area, your ophthalmology, is the coal eye ophthalmology. Are we going to see an expansion into this area?
100%. We've gotten the green light to do that, and we're raising the funds now to do so. And it's only a matter of time before we start to see ophthalmic patients. And ophthalmology is one of those unsung specialties of medicine in many ways. It has obviously a huge impact as far as welfare, but it actually attracts people for the first time to hospitals and to facilities to get care. And it's very important for us to establish a footprint to help support our hospital system, our emergency rooms that see ophthalmic patients, as well as our outpatient practices, which need to be supported by that. Just to give you a quick example, Sam, 40% of the patients who have diabetes right now in Martin and St. Lucie counties gets their annual examination for diabetes or eye examination. That's well below standards of the community. By putting an ophthalmology unit in, we hope to screen closer to 80 to 90% of those people so we can prevent vision threatening blindness, which occurs from diabetes, which is, again, the most common cause of blindness in the US in working age adults. So that's going to be a huge advantage for us to add to this. Amongst other things that we can talk about too, Sam, we have a fast track program at our Tradition Hospital that is valuable to our emergency services there, and also expanding the services we're going to be doing at South Hospital in regards to our mother baby unit there. There's going to be additional adds to our facility to help our care for our community through these programs.
Without going into details, because I can't go into details, but I think you know that I've been working behind the scenes in perhaps getting some hospital care into other areas of our community. We have a wonderful community, but it's a growing community. Is that growth a factor that you have to deal with?
Oh, absolutely. I mean, we've now had the highest level of nursing, 14% higher nursing than we had 4 or 5 years ago to expand what we can do. And population growth is anywhere from 3 to 5 to 7% a year. So we've seen that growth every year, year after year, which is pretty significant. And so we've upscaled our workforce in order to do that. We look at locationally where we want to be. We buy land and find out practice areas to be where we want to be from a locational perspective. And we're doing all that right now. So it definitely is an eye toward continually growing our organization through these sort of overall structures and strategies.
We've covered a lot of topics, and I know that just the nature of our conversation, we could sit here and carry on for another hour. Anything that we have not touched upon that you really want to make sure that we get across before we wrap up?
All right, so Sam, I think the first thing is we appreciate the community that we live in as an organization. We value their feedback. I would tell you, if anything, anyone leaves with today, please give us more feedback on what we could do better. Give us examples. I always tell everyone, give me examples so I can make things better and the organization can make things better. We have a huge team here and that's invested in it. And that's the second point, is we're invested here. We're not leaving, we're not selling, we're not doing anything else. Not a day goes by that somebody doesn't call me with some weird rumor about what we may or may not be doing. The answer is we're going to be here for the next 100 years. And as we have been the first 100 years in Ohio, we'll be for the next 100 years in Martin. And we will continue to expand the care that we can offer, number three, to our community. Because I live here just like you do. And I want everything here and being able to be accessible to our community. And certainly we didn't have that for a long time. And now we're getting that day after day and week after week.
Most important question of the entire program: can you come back for another episode in the future?
Well, love to, and love to give you updates as far as our progress, especially as we, grow the program this year.
One final observation. I'm looking out my window, and I can see out the window to your side, nearly sunny skies. And having spent quite a number of my adult years in Ohio, I will take this weather over the Ohio winter anytime.
I would too, except in days when I guess yesterday it was 60 degrees and I was walking around with a sweater on, because I've unfortunately become very acclimated to your environment as much as you have been. And it's a real pleasure being down here. I have to be honest with you. I could not have asked for a better place to be. I started this conversation by telling you how fortunate I felt, because I didn't know much about Florida, to be honest with you, before I came down here. And I really found a community that is enveloped in growing, improving, and really helping those around each other. And that to me is a big reason to be here and to grow this or entity.
Well said. Dr. Rishi Singh, Vice President, Chief Medical Officer, Cleveland Martin Hospital Systems. It has been my pleasure to have you on the program today.
Thank you, Sam. Really appreciate it.
And until our next episode of the Florida Business Forum, I'm Sam Yates. Have a great day, everybody. The Florida Business Forum is dedicated to showcasing Florida businesses and CEOs of all sorts to promote their business or not-for-profit in the only business forum of its type in Florida. Thanks for tuning in, and remember, have a great day, everyone, and stay tuned for more business.